let's begin with what is the overall strategy for Uttar Pradesh. Would you want the lockdown to be extended post April 14th or an overall staggered lifting of the lockdown?
It will be extended, but we have gone ahead with a certain formula of, I would say, sealing the hotspots. And now, whether the hotspots, while we are sealing, totally are sealing, it gives us a good result. Although the Kanpur did give us a good result, if that gives us a good result, then certainly that could be a way forward after 15. But I will not say that is the way forward. So let us wait till 14. And what are the results of sealing the hotspots? And if required, we may continue that way, or we may just continue, with the lockdown of the total all the districts, or we may just lift it in consultation with the government. So all three options are still open.
Okay, so what I was actually earlier asking you, and we couldn't hear you at that time, Mr. Siddharth Nath Singh, in the specific 15 districts where there are parts which are in absolute lockdown, how is the state ensuring that everybody gets the essential goods, necessary medicines, and whatever help is required?
Well, as far as the essentials are concerned, including the medicines and including the medical care, those availabilities are ensured by the state government. And to their doorstep since morning, if your cameras had rolled, since morning there were, essential good services, vehicles around there at the sealed gates, I would say. And people have been given, so they all are quite satisfied by now. And they know that government is there to take care of their essentials. And if there are medical requirements, then 112 is a quite efficient working ambulance service in Uttar Pradesh. So that can be approached, and the answers will be given. So, including the hospitals, we have identified near to the sealed areas. So all those infrastructure availability, infrastructure for delivery of the essentials, all these things have been taken care by the government while announcing.
Okay, there are two big challenges, especially for states like Uttar Pradesh. Let me begin by asking you about the Tablighi attendees. Has the state managed to trace down everybody, or are there still concerns that some may be hiding, not revealing their travel history?
Well, if you look at our numbers, particularly the Tablighi Jamaat did add to those numbers, and substantially they have added to those numbers. But we got the list from the central government. They were all about 569 odd numbers. They all have been identified, and they have been approached. They have been taken into quarantine. They have been tested. So that part is over. Whom they had met, or the people who came in contact in UP, they have been also, the list has been prepared, and mostly all of them have been taken into quarantine. So about 63,000 in UP, including them, are in quarantine, and we have enough beds, we have enough facilities available. So I don't see that be a problem anymore, but certainly it did add to a problem initially. It was unfortunate. I think many other states that unfortunate of Tablighi Jamaat, and they continue adding because they have a habit. Some of them we had taken for testing, and it's very unfortunate. While they were in the hospital, in district hospital, they started spitting around or creating little ruckus there, and sitting around was not a good sign of what the intentions could have been, or the intentions were there, and then the country would have faced the problem.
Important indications there that have come in from that interview.